Exactly 1 week ago, health officials called a press conference in Belize City where it was announced that they would be taking a proactive approach against the human papillomavirus, HPV. It was proposed that young girls currently in Standard 4 would be the ones getting the shot aimed at preventing cervical cancer. Of course, this would have happened with the consent of the parents, but from what we have learnt, the consent is not so forthcoming, as parents are concerned of the side effects and the long-term effects as well. Love News sought an update from the Director of Health Services, Dr. Marvin Manzanero, who says that they are aware of the concerns being expressed.
We are aware that there's a little bit of a revolution, and we're noticing the social media situation in terms of some negative feedback and what I think are some serious misconceptions, I think, floating around. We can't be defending everything that goes on social media. I think the best thing is we have to be cognizant of where we are and try to be having interactions on an individual basis at the different schools, and also using different media outlets to get our message across. But and again, this has to do with misconceptions, because this vaccine has already been in country for more than 5 years. It's not like you're putting anything new in Belize.
Despite the dozens of reports available online that speak to the effects of the vaccination, Dr. Manzanero noted that the ministry has done its homework both locally and regionally, and there are no adverse effects from the HPV vaccine.
And the information we have managed to gather from being administered in private sector in Belize over the last 5 years, no adverse or serious side effects have been reported to those who have gotten it, who have actually had to pay for it, and have gotten it in Belize. And again, when people float around ideas in terms of very adverse side effects, I think we have to be aware and cognizant of where the source is, because most of the internet stories are not necessarily true. Not everything that Dr. Google says is entirely true. So you have to be able to document the source and take it from there.
Now, you said that you have had no adverse effects reported locally. Is that the same case in terms of around the region?
We asked around because, as we had noted, we are one of the last countries to actually embark in this process, and nothing as what the media is, social media, then is suggesting. Actually, when you look at the stories and the links of where people are reporting it, I mean, it's a legal lawsuit against the Spanish group, those kinds of things. It's on an individual basis, but the scientific evidence behind the vaccine, I think, is rather overwhelming when you read it in that context. And you also understand that other countries such as Australia have been administering this for more than 10 years now.
With the concerns being expressed, Dr. Manzanero says they will embark on an educational strategy, but in the end it will still be up to the parents to decide.
I think it's educating folks on as I said, on an individual basis, and trying to have media interaction. At the end of the day, the parent makes the decision of what will happen, I think, because you have also a sizable amount of people who are beyond Standard 4 who want to be included in the vaccination package. So after we have done our rounds and you have the uptake that isn't there, the vaccines will be given to those who go on a waiting list right now. So I am fairly confident that we will make use of the vaccines, that you have more people then that are being properly educated in the process, and they will have to start an uptake in terms of this vaccine.
The cohort chosen for the 17 doses that are already in country will be young girls in Standard 4 who are not sexually active.